Welcome back. So government says it has managed to come up with measures to plug the gap left as a result of the withdrawal of aid from the United States. To give us more detail, we are joined by the Health Minister Dr Aaron Motsoaledi, who says the department approached National Treasury and other funders and managed to raise R1 billion funding, which is, of course, a boost in the process. Minister Dr Motsoaledi, thank you so much for joining us once again, and a good evening to you. I do want to do this, perhaps if we do a little bit of mathematics for the sake of our viewer to really make sense of it, right? The country, and you'll clarify for me, losing out, is it around 8 billion rand in funding after the US essentially cut the PEPFAR funding, correct?
Good evening, Naledi. Good evening to the listeners and viewers. Yes, PEPFAR was giving us 7.8 billion rand.
Right. Yeah, so 7.8 billion rand, and we're plugging that big gap. How have you managed to do this, Minister?
Yeah, firstly, let me start here, Naledi, because I am realizing people are talking about plugging a big gap. There is no way we can plug that big gap that was left by PEPFAR, neither by our government nor any other international funder. And international funders have told us so. The reason is that the manner in which the money from PEPFAR was used, Naledi, was in the manner in which the American healthcare system is run. The American healthcare system is huge on money, but very small on results of healthcare like mortalities, etc. Because of their financing system. Their financing system is top heavy on people who administer the system, not top heavy on patients. That means the money doesn't go to patients. It goes mostly to people who administer the system. And that's where the difference is. And we won't be in a position to emulate that. We are plugging the gap in a new manner of saying, in our case, this is what suits us, not just plugging the gap of where they've left off. Yeah,
because 7.8 billion rand would be a lot, but you've got quite the plan. Unpack it for us. You've got some funding coming in from Treasury and some international organizations.
Yes. What happened is that we approached Treasury as soon as PEPFAR pulled out. Treasury then told us that we need to prepare 10 plans, one for each of the provinces, and show their needs, their immediate needs, not plugging exactly what was left, their immediate needs. And remember, PEPFAR was in 27 out of our 52 districts in only 8 provinces. So Northern Cape is not involved in all these things. So we had to draw a plan for the provinces that were affected. And Treasury then said the 10th plan is for the whole national. Then during that process, the international foundations, Bill and Melinda Gates Foundation, as well as the British-based Wellcome Foundation, they gave us an offer. They said, look, tell your Treasury, if we pay you 100 million rand each of us, can your Treasury match it with 200 million? So that you are not just receivers, you are also helping yourself. So the Treasury said, deal made. So Bill and Melinda Gates Foundation and Wellcome Trust Foundation, each one of them will pay 100 million, which then means Treasury must pay 400. That means match each one of them with 200 million. So what happened is finally the Treasury put aside 753 million rand, and it was divided into 3. The first is 590 million for delivery of health services, HIV/AIDS services in all the provinces. The second was 32 million coming to national for strengthening pharmaceutical services, not buying ARVs or what, but to strengthen our system, like the Central Chronic Medication Dispensing and Distribution Program, etc., etc. And lastly, 132 million for these researchers, because the Bill and Melinda Gates Foundation said, no, we are giving money only for research. We don't want HIV/AIDS and TB research to stop because it will reverse lots of things. So we are giving this money for that. So Treasury said, okay, but the 400 million rather, they won't be able to pay at the go. They said they'll pay it in tranches for a 3-year period. That means every year for 3 years. So their first tranche was 132 million. So when you add 590 plus 32 million plus 132, it will give you the total of 573 just for this year.
Right.
The 132 going to match the money for researchers. So yesterday, we met the researchers under the auspices of the Medical Research Council. We met our universities and research institutions and say, this is the plan, and they welcomed it. They are going to be calling a press conference sometimes this week.
Yeah.
Or early next week.
Yeah, that is incredibly important. And if you, I mean, you've touched on really where these monies will essentially be able to be prioritized and where they'll be put in. But the concerns that you have around the gaps that we may have left behind, and perhaps this is how you encourage for even more support to come in.
Yes, we are still waiting for more because we've been meeting more funders. For instance, I can disclose to you that we even applied to the lottery, basically because in 2010, when we launched the world's biggest HIV counseling, testing and treatment campaign, which has brought us here where we are, where we have tamed HIV/AIDS, the lottery gave us 70 million for that campaign. We went back to them and said, can you repeat what we have done now that we are faced with this challenge? And they agreed. We met them. And they told us what to do, what to write in the application. Today, they are delayed by the fact that I'm sure you are aware there's a change of guard in the lottery. And they said immediately those things are settled, they will tell us finally how much they are giving us. So we're waiting for that. We have also met the Solidarity Fund, which was established during COVID. Even them, they said there's a bit of an amount left there. We are waiting for them to do something. So there are many other funders we are waiting for.
Yeah. I want to look at other issues because, of course, this is part of the work that's come out of the plans that you've made as well in the budget for the National Department of Health that you tabled today. And a few other themes that have come up. There's been the issue of the shortage of doctors, posts that need to be advertised, and you've made some allocations for that, Minister. Let's talk about that because it has been such a hot potato discussion in the country.
Absolutely. Remember, Naledi, we had one problem. Of course, Treasury doesn't like us to put it this way, but it's a reality. Public health suffered austerity for a decade. Austerity means budget cuts for social services. And that has happened for decades. Treasury decided to get out of that. They clearly said they want to stop this austerity. So their starting point was to give us 20 billion rand over the next 3 years to try and reverse the austerity. When you divide it, it gives us 6.7 billion rand a year. So we decided, what impact can this 6.7 billion do? We called the National Health Council, where all the MECs are there, the Surgeon General of South African Military Health Services, SALGA, because some metros are running clinics. We said, what impact then this money do? And we eventually agreed on 4 things. Number 1, to employ 1,200 doctors, 200 nurses, and 250 other health workers. That's number 1. Number 2, to populate our hospitals with some of the things that makes them unhospitable, like beds and linen and towels, and So we identify 1.4 million articles that are needed. That includes pressure beds, bassinets for babies, etc. You may remember, Naledi, the very painful and embarrassing story of babies in Northwest being put in cardboard boxes. Yes. You remember that?
Of course, yeah.
Yes. Now, to stop that, we are going to order 76,000 bassinets. Those, small beds in which you put babies, not in cardboard boxes. So we said all those things, articles, will cost 1.3 billion rand. That's the second thing we're going to do. The money for hiring doctors and nurses will cost us 1.7 billion. So this one will cost us 1.4. The third thing we want to do is to absorb community health workers who are running around our villages every day. They've been doing that for more than 2 decades, but being brought by NGOs and not permanently employed by the state. We need to start getting them, especially with the pulling out of PEPFAR. You need a lot of community health workers. Then the fourth amount is to pay the accruals that accumulated over the years of austerity, whereby you are owing oxygen, you are owing for blood, you are owing for laboratories, and you are owing for equipment. We are going to pay them at least 3 billion rand as a start, and next year we'll keep on increasing. That's what we are going to do with this money, 6.7 billion, which is extra to our budget.
Minister, the last time we spoke, we were, of course, reacting to that report of the Section 59 committee that had handed you their report into some of their findings of how black health professionals were being, I suppose, targeted, if you will, by medical schemes. I know that it was just after you'd received the report, you're seeing some reaction from some of these medical schemes. The engagements that you hope to have moving forward on that issue, and I know that you've mentioned in your budget as well that that is one of your last priorities as well for this financial year.
Yeah, we've got 3 priorities. The first one is the improvement of public health facilities, and we've given an extensive build program, infrastructure, and of course this buying of linen, etc. And then the second priority is to start a process to eliminate diseases. We are warning that South Africa mustn't get used to living with HIV, AIDS, and TB and believe that is just a way of life. At some stage, we must get rid of them, and we've got plans to do so. That's our second priority. The third one is that we need to start making serious reforms, very significant reforms in the private healthcare sector. People are shouting at us now. They say, we must leave the private health sector alone. There's nothing to fix there. I'm sure you have heard that many times. We must concentrate on the mess in the public health sector. The private is running very well. And I'm sure you'll agree with me that on Monday, it's just one tip of the iceberg of why it's not running very well. But remember, we also have the health market inquiry done by a former Chief Justice Ngobo, which also shows the problem that are happening there. So we can't fold our arms, because I'm not a minister of public health. I'm a minister of health, which means both public health and private health. I must make sure that I do something about them. If there is a problem, I must look at it and fix it.
Yeah. Minister, thank you so much for your time as we look at what the Health Minister, of course, has tabled in his budget. He is the Minister of the Department of Health, Dr. Aaron Motsoaledi, speaking to us once again.